to deal with the patients who have failed IVF cycles. It's very disappointing for the couple. They'll become distressed, they'll be depressed, so much stress, so much anxiety. They'll become financially weak, mentally weak, and it's very difficult to cope up this situation for the doctor and for the patient, because they'll struggle so much to face this situation. So we should give some time to cope with the situation. So meanwhile, so we should prescribe some antioxidants, folic acid supplements, and melatonin supplements for both wife and husband, to increase the egg quality, to increase the sperm quality. And every day they should have counseling sessions. We should tell the success is around 45 to 50%. It's not 100%. So many people, they'll think that IVF is a final treatment, so we'll get 100% success in that. So give counseling like that. The success rate is 45 to 50%, so that couple will have that figure in mind. So they'll accept, even if it is negative, even if they did not get pregnancy, they'll accept if you have that success rate in their mind. And one more thing is, and we should advise some extra tests for the husband and wife. So if there is any semen abnormality, we should advise some extra tests, scanning, ultrasound of the scrotum, and DFI test, DNA fragmentation index, to know the more clarity, to know more lacuna if there are any. And the females will advise some more tests depending on the problem, like karyotyping will advise, and will at the same time will give supplements for both the mother and the father. At the same time, we need to evaluate the endometrium by histolaparoscopy. We'll take the endometrium sample, we'll send for the biopsy. So we need to check whether there is any infection in the endometrium. It's called endometritis. So all these things we need to get clarity. So we need to check the embryo, we need to check the egg, we need to check the sperm, we need to check the endometrium at the same time. So we'll advise some more test for the embryo, like embryo biopsy is the last option. We can know whether the embryos are euploid embryos, any problematic embryos, that's called as aneuploid embryos. So this thing we can guide them. One more test is endometrium ERA test, endometrium receptor sampling. So in this test we'll get exact date, exact time when to put embryos inside after the progesterone injection. So these are little bit high-end investigations. If the first IVF fails, we need to guide all this to the couple. These are all little bit financial burden to them. So just give some time to cope with this situation, and we need to guide further. And at the same time, we need to tell them they should decrease stress level. So healthy lifestyle, healthy food, and yoga, pranayama, any breathing exercise, stress relief. So whatever it may be. So they can play group activities. All these things we need to guide the couple.